there, and welcome to the Psychology of Black Womanhood podcast, where we break down the research examining Black womanhood and talk about what it really means in our everyday life. I'm Dr. Dionne Stevens, co-author of the Psychology of Black Womanhood book and a psychology professor. It's no secret that Black women are 3 to 4 times more likely to die from pregnancy-related complications. Factors like implicit bias in medical settings, healthcare access, and social determinants of health directly contribute to this disparity. There's an often untold part of this story, the importance of the involvement of Black mothers' partners. Fathers can play a crucial role in supporting Black women by advocating and navigating the frequently disjointed healthcare system that Black mothers are placed in during this really critical time. Unfortunately, conversations about maternal health are often isolated, and fathers are often made to feel like it's not their role or are not given the skills and knowledge to manage these emotionally charged situations. In today's episode, we'll be exploring how fathers can be key advocate for Black maternal health, working alongside providers and communities to reduce these disparities. This conversation is being led by Dr. Valerie Newsom Garcia, the Director of Programs and Grants for Kira for Moms, a national nonprofit working for improved maternal health outcomes. Prior to this role, she worked with the National Healthy Start Association and held faculty positions at schools like NYU, Morehouse School of Medicine, and Brooklyn College. Dr. Newsom Garcia was also a fellow at Harvard University's T.H. Chan School of Public Health, where her research is focused on social, environmental, and structural determinants of health, particularly in underserved communities. I heard your story at the Psychology of Black Women Institute. Maybe you can share with us a little bit about this birth story that ties into this experience that a lot of Black mothers are feeling and experiencing.
You know, I've been working in public health for several years, and I was aware of the Black maternal health challenges that a number of women have been facing. The incident that was most striking to me was when a friend from college, Charles Johnson, who is the founder of the organization I work for Care for Moms, he lost his wife following childbirth, which should have been a routine C-section, but essentially it was botched and she lost her life. His story, their story, I had a number of friends who had near-miss events, which is when you almost die, related to childbirth. And so I was really nervous going into my pregnancy. But I also felt that having that awareness was helpful so that I could kind of think through, okay, well, if X happens, then how can we respond? What are all the things that people are doing to reduce their risk for having these types of events? Well, let's do those things, right? So my husband and I came up with a birthing plan. You know, we were trying to do everything as natural as possible to just kind of avoid some of those medical interventions that can kind of cascade into having intervention after intervention that also increase your risk. I started having contractions like on a Monday, and I was in what they call prodromal labor, where I'm having contractions, but it's not really advancing. The baby wasn't really moving down, and they kept sending me back home. Like every couple of days, I was going back to the hospital, and they're like, "No, you're not in labor. Go back home." So my water finally broke on a Friday. So we went to the hospital. We're like, "Okay, great, it's game time." And they were about to send us back home because they said, "Nope, your water didn't break." I was like, "I'm pretty sure that it did." And my husband said, "You know, I've seen water break before because this was not his first child." And he said, "I'm pretty sure that's what it was." And they said, "No, they're preparing to send us back home." But they had my baby on the monitor. And so her heart rate changed. So that's why they admitted me. Thank God. I had a doula and she was amazing, but her presence it didn't seem very welcome by the OB that was on staff. The OB that I've been working with all throughout my pregnancy wasn't on that night, but my midwife was there. But the doula wasn't allowed to speak when the doctor was in the room. The doctor, in fact, rolled her eyes when my midwife introduced the doula as being present. So we end up needing an emergency C-section because I began to have a fever and develop an infection. And my daughter's heart rate was kind of all over the place. So did the emergency C-section. In preparing for that, the anesthesiologist told me that the epidural that they had given me earlier wasn't put in correctly, and there was no medicine even getting. And I told her, I was like, I can feel my legs, and they kept telling me, no, you can't move to push because you can't feel your legs. And I was like, I can feel them. So there was just a series of errors throughout our time there. The doctor who, again, the one on call that night, she never spoke to myself nor my husband. She only spoke to the midwife. Even when they delivered my daughter, she didn't say congratulations to the girl, nothing. She just handed the baby over to the midwife, and our midwife was the one that said congratulations. My daughter was born with an infection. She had to go to the NICU and stay for a week. And then a couple of days after we were released to go home, I ended up having a postpartum hemorrhage and going back to the ER, and then having to stay in the hospital for another week to recover. So, now I'm trying to figure out, how did all of this happen? Even when they told us that my daughter had an infection, we're asking questions like, well, what type of infection? Oh, we don't know. We're just going to run some tests and just give her a series of antibiotics. And so later, kind of putting the pieces together, we realized that my water broke when we said that it broke. She had been in there for way too long without fluid. That's how she developed an infection, and I subsequently developed an infection. And then the hemorrhage was caused because they were rushing in the C-section and didn't clear everything. So there was still pieces of my placenta attached because it essentially disintegrated because, again, she had been in there too long after my water broke. And that's what caused the hemorrhage. Now, all of this was discovered by myself in reading back through my medical records and then sharing what happened with me with other medical professionals outside of the hospital to say, these are the things that happened. The infection that my daughter was born with is well known. I was really frustrated by the fact that the medical staff at that hospital feigned ignorance, and I had to kind of put these pieces together. I wrote a letter to the CEO and the COO of the hospital. They apologized for my experience, but said that they found no wrongdoing on the part of any of the medical staff. And it was doubly upsetting to me because that doctor was a sister. And so, a lot of times when we talk about racism in the medical system and how folks are treated, we think it's a black and white thing, right? But it's not, it's a system thing. And it's about how medical professionals view the worth of their patients and the people who come through that hospital. In fact, when the founder of our organization, Charles Johnson, when his wife, Kira, was in her situation, it was clear that something was wrong. And he was begging the medical staff to come see about her. She had blood in her catheter. Someone told him, one of the medical staff told him, "I'm sorry, sir, your wife is just not a priority right now."
This is the first time when I heard the story, I didn't realize your doctor was another Black woman. That's another layer. But you had a midwife, you had a doula. You also have friends who are medical professionals, and you yourself, you're a professor at Morehouse. You have been a Harvard fellow. You are educated specifically around health issues. So you're someone technically who has a lot of privilege around information and access, and you still went through this. So I'm wondering how this then brought you to the organization for Kira for Moms.
Throughout my career, I've always tried to make sure that my work aligned with things that are really important to me and Black people, and our health, our joy, our mental health and our physical health is really important. And I knew that at some point I wanted to move into looking at Black maternal health more specifically. But because I knew of Charles's story, and again, like I said, other friends who almost died related to childbirth, I wasn't ready to focus squarely on that before I had my own, pregnancy journey, because I just didn't want to be just overwhelmed by all of that at the same time. So after this happened to me, I called Charles Johnson because I was ready to sue. I was like, all of this is like egregious. This is totally wrong. Like, someone needs to respond to this. I need more than a letter saying, sorry, this happened, or sorry, that was your experience. And so I called him to kind of get some guidance on what are some next steps. So we talked about that piece. And I told him, I was like, look, I'm ready to go. I'm ready to jump in the fight. What do we need to do? And he gave me a really great piece of advice. And that was to take a minute before I started kind of publicly sharing my story, to kind of have time to really sit with it and be okay with it and not feel like I'm reliving the experience every time I'm telling it, right? So that's helpful for me. So I didn't go directly into working for Cure for Moms. I worked for another maternal health organization, and then I came over to For Cure for Moms. It's been really wonderful because there are a number of organizations doing maternal health work, right? But to be able to do this work with people that you know, so Charles and I have known each other since college. Our executive director, Gabby Albert, we all went to FAMU together. And so just to have that personal connection, know the people you're working with, know that they are truly mission driven and able to get out there and do this work. Like a lot of times people assume that our organization is big because we do so much, but it's literally 4 of us. And we're small but mighty. But it's a beautiful thing because we can put our heads together and talk about what we're seeing happening. Well, what's missing? How do we want to fill that gap? And so one thing that we saw is missing in the discussion on Black maternal health is the fathers. So a lot of people are familiar with Charles's story from the fatherhood perspective, because sadly, sometimes the fathers are the ones left behind to tell the story, right? And so we really wanted to think about building on the work that he's been doing as a dad and elevating this conversation all the way up to Capitol Hill, right? But also at the local level, and thinking about how to share that with other dads who are now, historically, dads used to just go to the hospital. They weren't even in the room during delivery. They just come out, say it's a boy or a girl, and light up the cigar, right? But that's changed. Like fathers are now in the room, and with that, that's great. But also because of all the things that are happening, they're in that room, but also feeling very nervous and stressed, which is typical, but also very afraid for different reasons, especially our Black fathers, because they're hearing now about all these things that are happening to women in childbirth, particularly Black mothers, and not necessarily feeling prepared to help them navigate that, to protect their partners in pregnancy and delivery.
I'm listening to all you're saying, and it seems like it would be logical that fathers should be there with mothers during the pregnancy till the aftercare. But I'm wondering, how do you start empowering fathers given the history of fathers not being included in this, even in cases where they want to?
What we've been talking about is ways to help elevate the role of the dad, because contrary to the stereotype, Black dads are very involved, and they want to know more to figure out how they can help protect their partners and their babies from having these negative outcomes that we're hearing about so often now. So we developed this program called For Cure for Dads. And it's web-based. It's an app. It provides pregnancy education, but it goes beyond just the education. There's all these apps for moms when you get pregnant where you can track what's happening with the baby this week and what are you going to be feeling and what can you start doing at this time. But there's nothing like that for dads. So we've created that where they have their own program. They can track what's going on with the baby from trimester to trimester. But they also learn about what's going on with mom. Where is she biologically, socially, psychologically? What's happening? How best to support? Helping to develop the birth plan, so that it's helping to kind of create more of a conversation, but an informed conversation where we're not putting, again, more work on the mom to educate dad on what to do, and where it's more of a supportive role. It also includes information about some of the urgent maternal warning signs. So if some of these symptoms pop up that may indicate some type of problem, the dads are aware too, because they usually have the first set of eyes on mom. And mom say, oh, I'm having a headache, but it's probably just I'm tired or I'm overworked. But it may be something bigger. And so if dad knows that, then he can also kind of push for, oh, well, let's call your medical provider. Let's just get it checked out, right? So really thinking about it from the lens of helping dads have all the information that they need so that they can feel more confident in their role as an expectant father, but also to be the best advocate for their partner throughout this journey. And so the cool thing about it is it's based on more of a sports theme to, again, attract the dads. And so each trimester is called a quarter, like, in the sports theme. And so we've released quarter 1, which is the first trimester. We will soon be releasing the second quarter, which is second trimester. We have a number of partners who have come aboard and still more coming on board to contribute to the content and Also, other kind of add-ons that are available to the dads, linking them to other apps that are helpful in tracking the pregnancy journey or getting information, getting vetted information to answer questions that they might have. Because, right now, all dads tend to have is just the World Wide Web in terms of answering questions, but that can be overwhelming. We're not always sure if that information is accurate. So we've developed this to be a one-stop shop for dads to be able to get reputable information, links to other services and products that may be helpful. And it's being really received well. And we think that it's filling a gap to help more quickly end this, again, avoidable maternal health crisis. But yeah, the dads are there and they're willing. They just need a tool. And so we've developed that tool. And so we're really excited about it.
We seem to be in an era where we have so much access to information. So it's so surprising that there are so few training options and resources for fathers to address this. Why do you think they've been overlooked?
Yeah, I think that funders don't prioritize father's role in maternal health. And I also think that without there being something structured, when men are at a point where they're expecting with their partners, there's so many things going on they're trying to get in place. If there's not already a structure created, a program created, something that they can just jump into, those are more barriers to finding that. So, right, I think that there's not as much fatherhood involvement that we can see because we haven't had a structure for it, for fathers to opt into. And that's where I'm hoping that this program that we're developing will kind of fill that gap and create a space for them to easily move into to get the information that they need to be the best advocates that they can be and find their space in the maternal health work.
Do you find that fathers are even aware about the risks that Black mothers are facing?
I think that people are becoming more aware. And let's also be clear, this is not a new phenomenon. Since I've gotten into this work, I've talked to women who had babies 50, 60 years ago, and they're like, this was happening when I was younger, but we didn't have social media to hear these stories. It wasn't getting the airplay that it's getting now. But we've been having these problems specifically for Black women for many, many years. But I don't think that at the community level, to answer your question, men in particular are as aware, maybe as women, as much as women are, because the women are just starting to kind of have more conversations about it. But even the women, I'll go to community events and so many times people are like, well, I heard, I know one person in my family. I know one. I didn't realize this was such a pervasive problem. Or I had this experience, but I thought I was kind of just like a one-off. And even when I did decide to share my story on my personal social media, I can't tell you how many direct messages I got from friends, family members who I had no idea they had similar experiences because we weren't talking about it, right? I think that our community is just starting to realize how much of a pervasive problem this is. And the men may kind of be on the back end of finding out just because they don't typically have the conversations about women's health like the women are, but they are pulled into it as their partners get pregnant or if something happens in their family or their community. But they are concerned. Once they find out about it, they're definitely concerned, particularly if they have a partner or a family member who's pregnant.
So you have this great program, which you described. How do men come to it? Is it when their partner is pregnant, or is it because somebody who went through something is telling them?
So I think that most men find our program because their partner is pregnant, or perhaps they're preparing to become pregnant. And maybe their partner is keenly aware of all these risks associated with pregnancy. And so this is a way to share that information with dad and help him get all the tools he needs so that they can be on the same page, have the same level of information, and figure out how to make the best decisions for their family.
And what are you finding are some of the barriers that they're facing, that they're telling you that they're facing?
One of the common barriers that I hear is trying to find the right provider, because you have to navigate health insurance. Well, you may have found a great doctor that you want to work with, but maybe your insurance doesn't cover that. The various hospitals, well, maybe they only deliver in certain hospitals, and maybe that hospital is not rated so well for X, Y, and Z, right? Them understanding what is the difference between a doctor, an OB, a midwife, a doula, and just trying to figure out how to put together their care team. That's another challenge that that we tend to hear, and not just from men either. Just as a pregnant family trying to figure out how you're going to get things lined up to have the safest birth possible, you really have to kind of piece that together for yourself. So that's something else that we hear people kind of navigating.
What kind of impact will men having this information have on the mother's outcomes?
So I think, firstly, being a pregnant woman, there's a lot that you're going through physically and mentally and emotionally, right? So to have that support helps a lot, especially when you are trying to navigate finding a provider or having not so great interactions with your provider and advocating for yourself. It's really difficult to ask a woman to be going through these things, especially birthing and advocating for yourself at the same time. It's nearly impossible. There are portions of my birthing experience that I don't even remember because I was exhausted. And I do know that my husband stood in the gap for me in those moments. My husband saved my life when I had the hemorrhage. And, there were so many points at which I wasn't in a place to be able to communicate well. And he knew what to do. He knew what to say because we put that plan together. Even in the things that we didn't expect, he at least had something to go to try to figure out what to do next, right? And so I think that that's definitely a place where dads are ready to show up. We just need to figure out a way to let them know what they need to know so that they can best do that, right? And so that's really what the program is designed to do. And listen, that partner, that man doesn't have to be the father of that baby. We need men from whatever walk of life. This can be the granddad. This can be an uncle. This can be any man who is available to support that woman through that pregnancy.
The presence of men in the room really has a different dynamic than women. And we're not downplaying presence of aunties, sisters, mothers. But I think men being in the room really shapes things differently, and they have a different energy that they can bring. What are some of the things that you have to think about when it comes to training men to be in the room?
So it's important to have a support person there, period. But what we're actually finding is that sometimes men, particularly Black men in the room, can feel threatening to some of the medical professionals, and that Black men may be at risk for being put out of the hospital if they, advocate in a way where those folks feel threatened. This is something that Charles has talked about, where Kira said to him, please don't get arrested in here. And so, this is a conversation I also had with my husband. Just, that's something that not all men even have to be as keenly aware of in terms of how they're presenting in a time where they have every right to be upset or afraid, So our program addresses that. Our program has been designed to be culturally responsive and understand the nuances in being a father, but also being a Black father and how to advocate in those spaces. So that's a part of the training that we provide in terms of what to say, how to say it, what to be aware of, understanding how you're being perceived and how to navigate that whole situation, which again is another layer of work that you have to do in an already really what can be a sticky situation. So that's one piece. But we definitely see where men are particularly helpful when it comes to the legislative piece of the work that we do, because when a woman goes and talks about her experience in front of policymakers, she's still there to tell her story. She didn't pass away, right? So they may hear the story, but when they hear it from a man who is the one who's been left behind because his partner is no longer here, it lands differently.
Right.
It holds more weight, so that's another area where whether the partner has been lost or not, we just see that the men have the heavier voice. They command more attention and more respect sometimes in those spaces. And so that's not the best thing, but it's the reality. And we have to be strategic in the way that we're mobilizing to move this work forward. And so having more people to ring the bell that this is a problem and it needs to be addressed, having the men step in to help with that work, it's needed. And so again, there are people who are doing this work. There are men who are interested. And so we wanted to create a vehicle for them to have a structured place to receive that information, that training, to be able to keep the work moving forward.
I think that's really important that you brought up the important piece of being a Black father, particularly during these times, and the existing stereotypes that existed for years around Black manhood and aggression, and how that puts Black men at risk. What kinds of things do you think about when you're thinking about the ways Black men can advocate for Black women during their pregnancy?
We offer some possible language, that like a menu of language that dads can utilize when they're in a doctor's appointment or in the birthing room to ask questions. Some of them are formed in questions and some of them are statements. And it's helpful because they also get practice. So in addition to the web-based program, we also are having in-person sites across the country. So we're launching our first in Georgia very soon. And that'll be a place where dads can actually come to receive training, where they'll be doing role plays. They'll get that practice in doing that so that if a situation arises, it's like almost second nature. They'll have some language in their pocket to pull. They'll say, I know what this scene looks like. I know how to respond here because they've had that training and that practice. But the other benefit of the in-person site is that it gives you a true sense of community. In those in-person meetings, dads will be able to receive kind of that social support from each other. They can talk about in community their concerns, the stressors, their fears. It'll really kind of make that a more holistic approach to this offering, where it's not just you at home on your computer or working through the app on your phone. So I think that that's also going to be helpful in terms of helping them feel, again, confident and have the information that they need and the support that they need.
In the future, what would you want to see fathers' role in terms of maternal health, particularly Black maternal health?
We would love to see that the men feel informed and empowered, because that will also support those pregnant women, where it's not on them to carry the baby, keep the baby healthy and safe, but also get the baby here safely and keep themselves healthy, safe, and survive that process, while also navigating all those other pieces in the process. So to have that support, I think, is what we firstly see as ideal. Yeah. I think the men can have the information that they need to feel confident, because that's one thing. I think regardless, any new dad in particular wants to feel more confident that they know what they're doing and that they can help support and protect mom and baby, right? That's our first mission. And I think that from that, they will be better positioned to be advocates if things do start to go wrong. And if they are that first line of defense in terms of having eyes to notice anything that looks amiss in terms of what mom is experiencing, and then be able to support and respond, I think that will help, again, to reduce the number of tragedies that we're seeing.
You were just listening to Dr. Valerie Newsome-Garcia discussing the importance of fathers' roles in preventing Black maternal mortality. To explore more of Dr. Valerie Newsome-Garcia's work, including For Kira, For Moms initiatives, and social media connections, visit this episode page on the Psychology of Black Womanhood website. Thanks for tuning into today's episode of the Psychology of Black Womanhood podcast, where research is really meeting the real world. With voices like Dr. Newsome-Garcia, we're hoping you're finding meaningful takeaways to carry with into your daily life. To stay up to date on new episodes and the latest projects, follow us on Instagram and Facebook. And don't forget to grab a copy of the book that goes hand in hand with the podcast, The Psychology of Black Womanhood. Thanks again for being a part of our journey. Until next time, let's keep growing, connecting, and centering Black women's lived experiences and the research that brings it all to life.